America has become a nation obsessed with dieting. This is consistent with the U.S. obesity and overweight epidemics, with as many as 71.2% of adult men and women classified as either overweight or obese, and a troubling 40% were obese. The prevalence is concerning enough that the WHO now considers obesity as one of the top 10 preventable causes of death worldwide, for which behavior and environment have been identified as primary causes. What in our environment can we point to as possible significant vectors for excessive caloric intake and the growth of obesity? In America, our appetites are driven by foods with high taste sensation. We have fallen prey to sophisticated marketing strategies that have essentially driven us to purchase foods that taste good, smell good, that are flavorful, but that are not necessarily nutritious. Corporate marketing strategies were so successful in creating a relentless demand for food that the idea of constant eating became an important part of the U.S. culture. Consequently, an additional 600 to 800 calories per person per day flooded the U.S. market, going from 3,300 calories per person per day in the 70s to 3,800 calories per person per day by the year 1990. So it is therefore timely to be studying in the field of foods and nutrition, because it is indeed clear that there is a strong relationship between the way we eat and the prevalence of chronic disease in American society. Students in programs of food and nutrition will learn about the proper selection of food for healthy living for children and for adults. They become agents that convey educational principles, right, of good behavior and good food selection, helping to decrease this prevalence, this rising prevalence of disease in American society. So part of a healthcare team working at the community level, working in hospitals as coaches, in clinics, in chronic care facilities, and so forth. So the job opportunities are great because of their formation of these students that understand the value of eating, but also understand the importance of good living, in healthy environments, of exercising, of expending energy, and they become good educational agents for the general population in order to guide them towards healthier outcomes and to overcome essentially this obesity epidemic that is changing the very fabric of American society. Historically, the food and nutrition program has been used to introduce students to basically a variety of disciplines and opportunities for careers, but at this time, Minnesota State is in transition and really redefining the options here for the food and nutrition program. For students interested in food science, laboratory work, MSU has a food science major offered through the College of Science, Engineering, and Technology. Those students take a lot of courses from Family Consumer Science. For students interested in agriculture, the business of food production, MSU is offering a new agribusiness and food innovation degree in the College of Business. Now, for students interested in working in nutrition, well, there are many other career opportunities that do exist. Now, an interesting question to ask is, well, where do graduates from programs in food and nutrition actually work? Well, if I were to draw a broad sort of sweeping understanding of where they can work, At the top of this diagram, we can see that they can work in hospitals in some circumstances, homes for the aged, chronic care facilities, and so forth, fitness centers, food service operation, and within the food industry. So this is kind of like the general sort of look if we were to do a broad sweep. When we look at hospitals, they usually work as director of the nutrition services department. In food service, they can be director of operations, that you can find in schools and universities and businesses. Within the sector of public health, nutritionists can work in food safety at the level of food safety auditor. In the food industry, I've seen graduates work with food labeling, and this is an important facet of food marketing, ensuring, of course, the compliance of the company to the guidelines associated with food labeling. As a graduate of a food and nutrition program, you may be asking yourself, is there a way for me to specialize? Can I get some credentialing above and beyond the FNN and work in a more involved way within various aspects of society? Well, the answer, of course, is yes. The health and wellness coach requires some additional credentialing and certification, and that's an important route and a significant one that has much growth. A master's in business administration, MBA, can get you more involved at the level of administration, and so you are administering larger departments, could be larger nutrition departments. You've got graduate degrees, MSc, master's degree, or a PhD, and here you're involved in research. That could be medical research, medical nutrition research. You could be perhaps interested in moving in the sector of food companies, and here you're looking at product development, and also you might be looking at certainly more advanced and sophisticated work with flavoring agents, for example. So this is well above the food labeling involvement that you get with a bachelor's degree, for instance. So it's far more interesting, far more involving, but of course additional training required. Now, in addition, students with a FNN degree can go on to get their master's in public health nutrition, and that's a very rewarding area. And here you're involved more in the area of community, developing programs, writing grants, trying to find ways to impact the community that you're in a favorable way with respect to behavior, with respect to food, eating habits, and so forth. And of course, the last option would be opening up your own business or working as a consultant in the field of nutrition. Well, now I want to take a closer look here at the wheel and focus at the top at health coach, which needs to be board certified. Certainly when you graduate with a FNN degree, you're not exactly equipped to go right into health coaching, but you certainly have the foundational knowledge to do so. I'm going to look at the various other options on this wheel, but I want to start with the health coach, because if your interest is sort of medical and health and well-being oriented, this is a great outcome for someone that has an FNN degree and wants to actually be part of that sort of medical slash nutrition specialized individual out to help people feel better and live healthy lives. All right, let's start with where health coaches actually work, and I'll give you an idea of the environments in which they're working, and perhaps that might be something that you might be interested in. So if we look at the various options. So where do they work? Well, they actually work in private practices. They've been known to work in doctors' offices, helping doctors really communicate or enforce what doctors are really strongly advocating, which is healthy lifestyles and good eating habits. They work also in hospitals. Some hospitals will hire health coaches in order to enforce that whole approach of changing habits, because we all know that compliance to medical directives is very, very difficult for a lot of patients. And so health coaches become really important in that context. Health insurers will actually use them as well. Corporations will use them in order to get their employees to follow healthy practices. Fitness centers have them, nursing homes have them, and even restaurants have them because of their knowledge in how to prepare and develop healthy menus. So health coaches are certainly a step up in terms of training. So with a food and nutrition degree, you can then apply to become a national board certified health and wellness coach. And there are various programs that are available to do this. Usually involves approximately 20 weeks. There's also the Institute for Integrated Nutrition that has some opportunities for the training of health coaches. There's overall a variety of certified professional coaches, CPCs, but the most popular training option worldwide is called the International Coaching Federation sort of certification. They've got different programs that are very, very good. In addition to that, above and beyond just getting your health coach's certification, the Institute for the Professional Excellence in Coaching, IPEC, if you've got some kind of a certification base, to get this heightened IPEC status takes about 7 to 9 months of certification. IPEC certification is supported by the Academy of Integrated Health and Medicine. It's supported as well or recognized by the Accreditation Council for Education in Nutrition and Dietetics and by the American Association of College Nursing. If you are interested in pursuing this sort of coach or nutrition or health coaching, I highly recommend to begin with the National Board Certified Health and Wellness Coaching certification. It takes about 20 weeks to complete, and there are about 110 health coaching programs in the United States that have this particular certification. There are two ways to look at, health and nutrition coaching certification or competency. There's a pre-coaching certification, and of course there are preferred requirements in terms of the training for coaches. In a pre-coach certification, you could be, for instance, attending coach certification classes, trying to pass a coach certification exam, for instance, accepting profile codes of ethics, including protocol adherence to certain rules and regulations regarding health and nutrition coaching. This is acceptable, but the preferred is getting a bachelor's degree in health, wellness, or behavior change discipline. 1 year plus experience as a real coach, or completing a national board health and wellness coach approved coaching training, which is really what I've been trying to advocate. Now I'm going to give you an example of a health coach position that was advertised a few years ago here in Minnesota. Now this position was featured as part of a profile by Sanford, and it's a nutrition and health coach, and this was in the Rochester, Minnesota sort of district. The minimum requirement was a bachelor's degree, and so food and nutrition, students or graduates have that minimum. A degree in nutrition, dietetics and food, exercise science or related health promotional disciplines are preferred, and the salary is about 17 to 21 hours, $21 an hour, and it's full time. So you're looking at a starting salary of about $44,000 a year. Not bad. So now what exactly does a nutrition health coach do in this particular circumstance? Well, he or she is responsible for delivering evidence-based protocols designed by the clinical advisory board while coaching profile members through the different phases of the profile program at different profile centers or employee sites. So very much related to a strong customer relationship with the profile members, with an emphasis on encouraging, of course, in this case, employee health. Let's take a look now at a director of food operations. And this is a reminder here that FNN graduates can move directly into these director of food operations in chronic care facilities and home for the aged, and even in small hospitals right after graduation. So this is one position as a food service director, patient services, Good Shepherd Community Home in Minnesota. The salary is basically $50,000 to $56,000 a year, and this is very typical for entry-level managers. And who can apply for these? Well, actually, students that graduate from food and nutrition programs without any real further certification. But I would encourage certainly students that get these positions to probably look at acquiring their Master's in Business Administration, their MBA. So then what exactly are these directors responsible for? Well, they're responsible for the delivery of foods and meeting labor targets, for example. So there's a human resource dimension. Ensure that food service connects with the executional framework. So in other words, making sure that the food you're delivering is consistent with policy and procedures. And of course, you're responsible in many cases for actually writing these policy and procedures. Adopt Aramark process and systems. So if you're hired by an outsourced company like Aramark, then you're going to be compliant to their particular processes. And these are great opportunities to get further training by these outsourced management companies like Aramark. I really can't encourage FNN students enough to consider this option because working with outsourced companies like Aramark, these are companies that will come in and manage the food operations in a chronic care facility or home for the aged. And you get tremendous amount of support from these companies as well as individual training. And that's a great career. You get very excellent dental, you get very excellent health coverage, and very good pensions. And you have an opportunity with these companies to actually travel nationally, but in addition, internationally. Here's another job posting for a dietary director in Pine Heaven Community in Rochester, Minnesota. The primary purpose of this job position is to provide quality food, nutritional services to residents, to clients through all entities really of the organization. The Director of Food Service will also direct and supervise the food service department to really assure that quality food, nutritional services are provided on a daily basis to the residents. And this will often involve overseeing the management of the people and of the workers, developing policies and procedures, but also developing menus, ensuring those menus abide by basic guidelines for healthy eating. Beginning salary here, just like the previous, $50,000 to $60,000 a year. Let's take a look now at quality control and food safety specialist positions that were available a few years ago. Now, this is a food safety specialist position that was available in 2021. The company that's advertising this position is Steritech, which is the market leader in food safety, quality assurance, and customer experience management. The opening salary $43,000 to $48,000 a year. So what essentially are their responsibilities? Well, they'll conduct assessment that measure the conformity to established regulatory, industry, and proprietary health standards, but they observe also food preparation, cooking standards, to ensure safety, sanitation practices. They'll teach and coach clients how to make their workplace actually safe. They'll travel 50% of the time or 10 days per month, including some evenings and weekends. So a little difficult from that perspective, but certainly a worthwhile career. Well, here's another food safety specialist, Rentokil Initial. This is in Rochester, Minnesota. $43,000 to $48,000 a year. So the qualifications are really a hospitality management degree, food science, nutrition, culinary arts, or other science degrees with at least 1 year experience in food service, restaurants and grocery operations. The specialist will help hotels and restaurants and grocery clients ensure that brand standards, food quality, and friendly service are delivered. They observe and look at the preparation of food that we've seen previously, that standards are respected for food safety and for sanitation. So, strong technical knowledge of food safety is preferred. These are great starter careers that are immediately accessible to food and nutrition majors. Let's look at the next option, which is opening your own business or acting as a consultant. Now, this is a rather interesting posting. It's a nutrition program consultant in Minnesota, $25,000 to $39,000 a year full-time position. So the primary role of this nutrition program consultant is to ensure really the effective conduct of school nutrition program in terms of their compliance to USDA regulations. The minimal requirement here is bachelor degree in food and nutrition dietetics, nutrition services, public health nutrition, or equivalent. So this is actually a very excellent way to begin your career, and this is why it's also important because of their insistence on having at least 1 year experience in related nutrition related areas. This is why selecting your program internship is so important in terms of documenting your actual involvement in some of these areas, and they certainly do open up doors for you to have certainly an opportunity to come into positions of this sort. As a consultant specialist in food service, you have that opportunity to provide services in merchandising, $65,000 to $75,000 a year. Good knowledge of food and catering with a focus on quality, production safety, cost control, marketing, and presentation. Here's a great position as a school nutrition coordinator, Hopkins Public School in Hopkins, Minnesota. So what does the job entail? Well, the primary goal is to ensure that the meals, the food service, are compliant to USDA meal service guidelines. Graduates are also involved in developing, establishing menus, food production, managing inventory, controlling the quality of food using the HACCP, guidelines, delivery of cost-effective food. These are wonderful positions that are really full-time and that are absolute career builders, starting primarily in small hospitals is what I recommend, and then moving up as you get your MBA and being able then to command higher salaries. Earning your master's degree in public health and working as a public health nutritionist, you'll find quite a number of opportunities opening up to you. Well, here's a position as a public health nutritionist. It's a public health or a community health specialist in the Robbinsdale, Minnesota area. Now, this public health or community health specialist isn't requiring a master's degree, but it is requiring certainly a BS in a health-related field, and certainly foods and nutrition qualifies. Minimum of 5 years combined with experience in community outreach and community health. This is also very significant. And so in this case, a master's is not required, but certainly coming in with a master's would make you a strong candidate. So the goal of this particular specialist is really to work with leaders in the community to improve really the health of this kind of multicultural community that we see arising everywhere. There's a specific focus to improve the health of underserved communities, and this is actually a very important role of these kinds of community health specialists. The specialists also participate in community health assessments that really take place probably every 3 or 4 years in a community. So very much hands-on with a clear focus with improving the health of the larger community. So in a nutshell, graduates in food and nutrition are really, I would say, trained to essentially make food delicious, safe, and nutritious, and deliver that food to schools and universities and hospitals in a safe way, develop menus for these institutions that are compliant to health eating guidelines, to nursing homes, to businesses. It's a very active and worthwhile career to follow. For those who are more adventuresome, it could be used as a stepping stone to medical school. So having a good foundation in food and nutrition provides that kind of strong basis along with meeting the other pre-med requirements. And don't forget that if you are interested in research and working in the fields of the food industry and product development, this is a very, very good option to take. So getting an FNN program is your stepping stone to your PhD or your master's degree, but you can also step into the field as well of medical research, because nutrition is very much tied to so many different aspects of nutrition. So for those that have a little more motivation, medical research, nutrition research in health are certainly options that are of great value.